Welcome to Pub Health TV, where we have real conversations about pressing public health issues and the challenges that community face. Today, we're focusing on intellectual and developmental disabilities, IDD, a public health issue that affects millions of individuals and families across the United States. According to a 2024 opinion article published by the Milton Memorial Fund, an estimated 7.4 million Americans live with IDD. IDD encompasses a range of conditions that affect cognitive functioning, adaptive behavior, and everyday life skills. The National Institute for Child Health and Human Development explains that these conditions are often present from birth and can impact an individual's physical, intellectual, and emotional development. One of the biggest concerns with IDD is access to quality health care. An integrative review by Catherine Shady and co authors identifies key barriers, including fear, stigma, and negative patient experiences, which discourage seeking care, impaired autonomy, where decisions are often made without patient input, a lack of provider training, leaving many healthcare professionals unfamiliar with IDD specific needs, limited accommodations such as sensory friendly waiting rooms or assistive communication devices. Because of these challenges, adults with IDD experience poor health outcomes and higher emergency department use than the general population. To explore these critical issues, we'll discuss barriers to access to healthcare, the role of supporters, the need for better provider training, and how quality assurance plays a role in improving care. I'm
Yeah.
joined by LuKesha Bradford, the Quality Assurance Manager with AID Indiana. Thank you for being here.
Hello, how you doing? Thank you for your invite.
AID of Indiana is an organization dedicated to providing essential services for individuals with IDD. What drew you to this line of work, and what does it take to support individuals with disabilities every day?
Oh, wow, and that's a big story. So, what drew me to this field? I'm originally from Arkansas. We have family members close to Fort Wayne, Indiana, and my mom moved up here, and one of her great aunts took care of individuals from Richmond State Hospital here in Indiana, which is a behavioral center, in her personal home. When she ended up getting sick, my parents took over taking care of three gentlemen with disabilities, IDD, should I say. It was a program where they lived in the home with families, and those families took care of those individuals as if they were family members. And so that was my first introduction to people with disabilities, about how to be a caregiver and what it takes to be a caregiver, and the things that you need to do for people with disabilities, as in medication or make sure that they definitely need taken care of, teaching them the ADLs. And these gentlemen were more higher functioning,
Mm.
independent gentlemen, but my mom and my dad still had to make sure that they were taken care of, make sure they were accountable to the state, and they had documentation they had to submit to the state. So that was my introduction to people with disability
Mhm.
many, many moons ago. I do have a family member with Down syndrome as well. She's one of my favorite cousins. I love her to death. Her name is Jasmine. I love her like no other. Here for Wayne, Indiana, here's a place called Fort Wayne State Developmental Center, which is a a center for people with disabilities. I worked there for 15 years. That is where I really got into doing what I do here. I love what I do. I can't not deny. I don't think I could be doing anything else in this world besides what I do as taking care of individuals, making sure we fight for their rights, make sure we
Mm.
fight for their independence, who they are as people, because they're not treated like people. And that's the worst part about it.
So you have it in your blood. You grew up around people with IDD, as you said, and that just sort of stuck with you and shaped your career and
Yes.
essentially become a part of who you are, which is why we need people like you, not only in healthcare, but working with vulnerable populations that often have no one to advocate for them. For those who are unfamiliar with AID of Indiana, what kind of services does the organization provide? How does it support individuals with disabilities in living full independent lives? You touched on it, but I hadn't asked you directly for the viewers.
We have several different things we take care of. We do 24-hour residential care. We do PAC. We do respite. We do transportation. We do wellness. For our 24-hour residential services, we have homes with at least 3 to 4 individuals living in a home together. Medicaid or Medicare pays for that services for them. PAC is where we go into an individual's personal home. So say if I had a son or daughter or a mother or father or sister or brother, someone who lives in my home with me who needs services, we will hire, it's called pick list, and go to your case manager, and your case manager, hey, I want AID to be provide me PAC services for my daughter or son or whoever living with me. Staff coming in to give assistance to me, giving me a couple hours to go to a doctor's appointment
Mhm.
or running for my consumer or doing ADLs with my consumers, doing daily activities, doing some DHI, which is daily have, taking to the movies. That is PAC services. And that's also with respite as well. We also do transportation. If our clients need to go to doctor's appointment, our staff takes them to their doctor's appointments, to the movies, anywhere they need to go. The state does provide to some of our consumers in their budget transportation. But if budget doesn't even apply, we still provide transportation. We don't say you can't go because the state don't pay us for it. That's not how that works for us here at
Yeah.
AID. We still provide services, no matter if it's getting paid through the state of Indiana or not. We're going to provide that service for that consumer. Wellness, every location, which is every 24-hour care home, the staff and the nurses get together on the medical needs for that client. Be a medication, a Band-Aid, or running to a doctor's appointment, or taking them to getting them out in the public, get them out in their community, take them on a walk, take them to the park, take them to the grocery store, showing them how to grocery shop, showing them how to budget their money. Our clients even have jobs. And so we teach them, pick them up, drop them off, assist them, making sure that they're on time to their jobs, they're clean and neat and is presentable for their jobs. Those are some of the services that we provide here at AID on a daily basis.
So essentially, you all provide every service that as you're saying, consumers would need to survive and thrive and to have
Yes.
a quality of life that's respectable.
Yes, a well-meaning life. Yes, definitely.
Mhm.
That's some our honor Joey Booth wanted for us.
I want to congratulating you on being named Employee of the Year at 8 of Indiana. I saw
You.
a video of you on social media receiving the award, and it was clear how much this work means to you. In fact, I believe you got a little emotional.
I got a lot
What
of
what did that feel like for you?
it felt like everything in the world. It just felt like I was seen, I was heard. All of those years of doing this, it meant something to somebody else that I am there to help. It just meant the world to me that they truly love and appreciate me at Aid of Indiana for all that I do. I cry real hard.
It's nice to have an organization where you feel appreciated, and it's not very often that you look forward to going to work every day. As a matter of
Yes.
fact, I looked at your organization's YouTube videos on the website, and it was apparent that people are happy. I believe some people said they don't mind coming to work every day. They feel supported, that the organization is genuinely concerned about their well-being. I commend you all for that, because quality often starts with how we treat our employees. So kudos.
Thank you so much. That is one of the main reasons why our founder, Joy Booth, started AID. It was something that we strived, or something we started talking about when we were at another company, and we didn't like the way they treated the staff nor the consumers. And so it was something that she made sure that us as the upper admin are making sure that we are treating our staff with the utmost respect and care because that trickles down to them taking care of our consumers.
I'm glad you get that. You all could teach some lessons to many organizations, not just in the IDD arena, but in healthcare in general. That's something we're missing and really may be attributed to the healthcare workforce shortages for people feeling a
Yeah,
lack of appreciation.
definitely, definitely that because if your staff doesn't feel appreciated, they won't work hard for you. They won't go above beyond. When I was teaching orientation, I stressed that the little things matter, especially to our consumers who sometimes more than likely don't have anyone outside of
Mhm.
our staff to visit them or take care of them or look after them. And so when you do come in and say how pretty you look or how wonderful, I'm so happy to be here with you. What can I do for you? We make sure our managers do something for our staff. Society is very stressful right now. And so people are very stressed over just the littlest things out in the community. And that trickles down to when you come to work, your attitude towards taking care of the consumers, the little things that they got to do, a client behavior might set you off. And so that's something we definitely strive here at AID is wellness between our staff and wellness of our consumers. And this is not for everybody.
Right.
Is a
Mhm.
people say, "I can what you do." I say, "I understand. I can't work in factories.
Right.
That's not for me. I
Yeah.
really don't I do." So I get it. It takes a special kind of person
Yeah.
to take care of with disabilities or a family member with disabilities because
Yeah.
it's a lot. It's a lot.
Absolutely. Let's talk about your role as quality assurance manager. I'm sure it plays a big part in ensuring individuals with disabilities receive care, as you mentioned, and they also need to have positive outcomes, both
Yeah.
policy wise and even regulatory wise. Can you
Mhm.
tell us about what this role looks like for you on a day to day basis?
My role is to make sure that we stay within our policy and procedures dealing with the state of Indiana. They have rules and regulations for people with IDD and companies to take care of people with IDD
Mhm.
and DDE. My role is to make sure that we implement our policies. The homes are up to standard. I do inspections or audits of the homes. I got to make sure it's up to state policy and state guideline. There's no tripping hazards or fire extinguisher works. The smoke detector works. Making sure staff are doing their documentation. Make sure staff is taking care of individuals, building their independence, building their self-esteem, giving them adequate care. Make sure they get out in the public. Make sure they get to visit their families or friends.
And that's a difficult role.
My supervisor, Monty Rogers Williams, is our A&E abuse and neglect exploitation investigator.
You mentioned the documentation, which is the bane of our existence,
And,
at least when I was working
um,
at the bedside. It can be tricky. You do play a major role in making sure that all the I's are dotted and the T's are crossed.
yes,
I'm
ma'am.
sure they
Yes, ma'am. I
appreciate
do.
you Employee of the Year.
Sometimes they don't. When I come, and pretty much they some of them like me and some of them don't. Depends on
No one
manager
likes
of
the
the house.
quality manager.
But I say, hey, I love you too. Let's do better.
Yep.
And that's all I can
Yep.
say is, I love you and do better, please. Because my statement to everybody is this is not McDonald's. This is not Burger King. You can't have it your way. We're taking care of human beings. So it's not like working at McDonald's or a store, Walmart. These are human beings. And everyone's a car accident away from being in care.
Mm, wow.
So what you want for yourself or your family members is the same kind of care we want to give out to our consumers. Because we're sometimes the only family members they have.
Yeah, that's kind of that's pretty deep.
Yeah, it is. I live by that. I can't even stress enough how much um it is the importance of taking care of our individuals, giving them the best care, because some of them have had a lot of trauma in their lives,
Mhm.
um, and it shows up
Yeah.
sometimes in their daily life, their things they do every day. And so, um, we want staff to be compassionate, caring individuals, understanding. Definitely, you got to be empathetic. put yourself in their place.
Yeah.
You can't talk. You can't move your body. You depend on somebody to feed you. You depend on somebody to change you if you are wearing Depends or pull-ups. You depend on somebody to take you somewhere or understanding what you're saying when you can't talk. Dealing with the younger population, we have to make sure they understand the empathetic part. Um,
What do you think that
I
breakdown is in terms of the generations?
okay.
I've even noticed it in other sectors, right? The change of the times where it just becomes a job.
You gotta have values. You gotta stand for something. They'll jump from job to job. Or they'll just quit at the drop of a dime. It's free paying your bills. Like, what
Mhm.
is going on?
Mhm.
Mm, sense of loyalty. Yeah, it's like
Yeah.
it's how you take care of another human being. Are you taking care of your kids or if another family member like this, neglectful, not cleaning them up, or
Mm.
having food all he's not giving them a bath. Why is it so hard?
Mhm.
Then that you got to care about the person you're taking care of.
You have to care about yourself in order for
Yes.
you to be able to care about others.
Mm,
Been my argument, formerly a hospice chaplain. It all starts from the individual, how they feel about themselves, how they respect their own lives. And
yeah.
if a person is able to accomplish that, it comes out in their work naturally. So,
Yeah.
how we see people interact with one another or patients in the healthcare system tells us a lot about the individual state. Um,
Think about it like that. Why not? Like, I with you. Like,
yeah,
let's like I said, the common sense is not common.
you're essentially doing common sense training along with the other types of training that you're
Yes.
doing that's specifically, skills oriented for the role. One of the biggest challenges in disability care seems as if from the outside is making sure that providers are trained to meet their unique needs. In
Yeah.
fact, 77% of primary care providers have no specific education in autism and IDD care. 92 feel unprepared to treat adults with autism spectrum disorder. How do these gaps in provider training impact the people you serve?
I can't even tell you the stories I have about going to a doctor's hospital or a hospital. And you just be sitting there like, okay, do I want to keep my job today or am I going
Mhm.
to
Yeah,
lose all of my religion?
yeah.
I mean, 'cause what you ain't gonna do is that. What you're not gonna do is treat my consumers like they're outcasts. Sometimes I have to rein myself in a
Mhm.
lot. They're mine. To me, they're my kids.
Yeah.
And what you ain't gonna do is that. Like, no. And so it's discrimination is not just in the housing market, it's all over. And it's sad because some of our consumers don't even understand that the discrimination against them. They're just sitting there smiling and happy. And you are sitting there with the ugliest face you can get, with your nose turned up, talking like, ugh, she drooling. Why they drooling? Wipe her mouth.
Mm.
Ow. Then we had a doctor stand in the doorway to give a pap smear. You stood in the doorway. I don't know how you do that. That's like surprising to me. You got to touch the client, actually come in the doorway. Oh, she fine. She don't need it. They'll refuse care. We have doctors' office. They tell us, no, we don't want those people here. We don't service those people. So it's very hard. It's very hard for us to find doctors who will take care of our individuals.
Wow.
Um,
I'm stunned on that one too.
it's
Well, and
true.
again, that's discrimination as well, right?
Yes, very much so. Very much so. And you, and your job is to give care, provide care.
Right.
So, why is somebody with IDD less of a person? I don't get it. I truly don't get it. Discrimination is in the housing market is all over. And I've worked with a company, and one of the homes I worked in, the neighborhood didn't even want our consumers to come outside on their own
Wow.
property. They
Wow.
they came, told us, "Don't they can't come outside." You like, "Who are you to tell me they can't come out? They pay rent. They are human beings.
Yeah.
What do you mean they can't?" Like, "We don't wanna see them. You bring our house values down." And You just look at people like, "Are you serious? Are you
And they
really
actually
serious?" No.
say that out of their mouths, huh?
Yeah, they actually say it out of their mouths, and they mean it. They mean it. They'll call the office or the management and at the office and, "Hey, complain about, hey, your staff are outside with your clients. Why are they outside? Why are they walking around our neighborhood? We don't want them." And, like, we're moving to a new neighborhood or something, they'll protest or write to saying, "Hey, we don't want those kind of people in our neighborhood because those kind of people will bring our property value down." How? Explain that to me. The discrimination is real against people with IDD.
There's a delicate balance between providing assistance and ensuring individuals have autonomy. And that
Yes.
autonomy is fair, and whether you're dealing with an aging population or a population of persons with intellectual and developmental disabilities. How do you all and how can providers help without taking over a person's independence?
Oh my gosh. Good question. Sometimes it gets hard because you want the best for them. You want the best for them. And so, and it's like your own, sometimes they become your own children. So it's something we have to continue to tell ourselves and our staff, hey, give her an opportunity to pick the toothbrush up or sweep the
Yes.
floor or unload the dishwasher. You got to give them the opportunity. You want to get it done quickly, but no, that's not the process. That's not why we're here. We're here to assist them to be independent to the best of their ability in all areas of their lives. And so sometimes we got to bring ourselves back. Like, hey,
Yeah.
our job is to be here to assist, give him or her the opportunity to do it themselves, give them
Hmm.
the opportunities, make the mistakes, fall and get back up. We always
Yeah.
want to hold them up. It's like you teaching your kid how to walk, watching your brand new baby how to walk. You're more giddy than they are. And they look at you like, what's you?" And I thank you. I really do thank you for this platform because people got to know that we're here and we're not going nowhere
Hmm.
ever.
Yeah.
And so used to it because we ain't going nowhere at
Yeah.
all. I really do appreciate this from you
Thank
reaching
you.
out to me.